Clap, 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 clap. Thank you, thank you. As you know, I am a human skeleton. Now, if this were real life and not some silly play, I would look a lot more like this. But would you really want to keep reading if I looked like this for the rest of the show? I didn't think so. Through the magic of pen and paper, I can be a standing, talking, dancing, boo, skeleton. Okay, fine, no dancing. For now. But I am going to tell you why bones are so bony. No, important. Bones are the underlying structure for the whole human body. When you look at the complex things that we humans build, you see how important an internal framework can be. Without their underlying structures to support them, these objects would look a lot like me when I was a pile of bones, totally useless. Our own bones work in a similar way. Take a look. There are 206 bones in the adult human body. I'm the femur and I am the largest bone in the human body. Some bones, like our leg and arm bones, offer stability. Other bones, like the skull and rib cage, protect our soft, squishy insides. And I'm the stapes, the smallest bone in the human's body, and you can find me in the ear. Looking inside the hand and the foot. Yeah, I'm riding barefoot. The phalanges. Looking inside the skull. The skull houses the brain and keeps it safe, kind of like a built-in helmet. Sack it to me. Looking inside the spine. Each of the individual bones that make up the spine is called a vertebra, but a bunch of them together is called vertebrae. This is quite a climb. 24 of the 33 vertebrae of the spine are connected with cushions of cartilage called spinal discs. This allows us to bend and twist. The other 9 are fused together. The spine also provides protection for a network of nerves called the spinal cord. Looking inside the rib cage and the pelvis. The pelvis cradles the organs of the lower abdomen, the small intestine, large intestine, and bladder, to name a few. The rib cage keeps organs like the heart and lungs safe. Phew! And it's not just us humans who have bones. We belong to a large group of animals called vertebrates. Being a vertebrate simply means that you have a backbone or a spine. Fish, amphibians, reptiles, birds, and mammals are all vertebrates. Sorry, worms, butterflies, clams, sea stars, and lobsters, you're all invertebrates. Meh. So far, we've only seen the outside of the bones. Although bones appear to be hard and solid, a closer look will reveal their true nature. I'm a bone cell, looking inside bones. Marrow. We're a pretty solid team, but there's always a little wiggle room. Fibers of collagen, a protein found in the skin and joints, give bones some flexibility, while the elements calcium and phosphorus make bones rigid. In the center of the bone marrow produces red blood cells. You'll see lots of me later. Marrow, along with the compact bone, acts as a mineral reserve. Extra calcium, extra phosphorus. If a certain nutrient in your body are gone or low, they can be taken out of storage in the bone and sent where they're needed. Pew, 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 go get them. The vitamins and minerals that strengthen our bones must first get into our bodies. Calcium from foods like dairy products, fortified juice and broccoli, and vitamin D from the sun help to keep bones healthy and strong. These nutrients are especially important when we are growing up. Speaking of growing up, I think it's photo album time. Oh, here's me as a newborn baby. Aren't I the cutest? We're actually born with over 300 bones, most of which are soft and flexible cartilage. As we grow, our bones begin to harden with the help of calcium in our diet. Some bones even fuse together. Remember all those separate bones that make up the skull? Oh, that's me when I was 9. I broke my arm that summer. School picture day I had lost my front tooth. As you are probably aware, bones can break, especially when you're not so good at the monkey bars. If I hurt a bunch when I broke my arm, but after a few months, my arm healed. Let's take a look at how bones are able to heal when they break. Yes, please. First, a doctor must figure out if and how a bone is broken. Any type of break in a bone is called a fracture. Doctors use x-rays to see pictures of your bones through the skin. Here's my x-ray. A complete fracture is when a bone is broken into two places. I had a simple fracture, and that means the bone was broken in one place. A comminuted fracture is a bone that is broken in two or more places or crushed. An open fracture is when the bone is sticking through the skin. A green stick fracture is a bone that does not break all the way through. Once the type of fracture is identified, the doctor will then set the bone by moving it into the right position for it to heal. If the fracture is in a larger bone like the femur or comminuted, metal plates or pins can be used to keep the bone from moving around. Since setting the bone might be painful, the doctor usually does this while the patient is under anesthetics. How am I supposed to keep that in place? Once the bone is set, it usually needs a cast. Cast can be made of bandages soaked in plaster or from plastic or fiberglass. A cast will stay on for about 1 to 2 months. Its job is to keep the bone in place so it can properly heal. During this time, new bone cells and blood vessels are made, slowly rebuilding the bone. Thanks a bunch. When the bone is healed, the cast is cut off with a saw. But don't worry, it's a special saw used for cutting through casts. Once the cast is removed, the injured area might be smaller because those areas weren't getting any exercise under there. The skin may also be dry and flaky. As you get back strength in that area, it will start to look the way it did before the break. I might even have you do special exercises to help the injured area get strong again. This is called physical therapy. Broken bones can happen to anyone, big or small, young or old. Here are some things you can do to help keep your bones happy, healthy, and safe. Remember those bone-healthy foods? Eat us! Regular exercising will keep bones strong. Protective gear like helmets and knee pads will help keep your bones safe too. I got this. There are more pieces to the skeletal puzzle. How are all of our bones connected? Joints! A joint is the place where two bones meet. All the 206 bones in the human body are linked together by joints. Fixed joints are set in place and do not move. You see those squiggly lines? Those are fixed joints called sutures. Cartilage joints are slightly movable. When I twist my spine, these discs of cartilage help it rotate. Doing the twist. Movable joints do just that. They move. Sometimes these joints are called synovial joints because movable joints are filled with synovial fluid. I help reduce friction when joints move. These joints can be found all over the body, and there are a few different types. Hinge joints, ball and socket joint, gliding joint. To top it all off, tough pieces of elastic tissue called ligaments connect bone to bone, strengthening each joint. Sometimes our joints make a cracking or popping sound when they are bent. Here's how. The synovial fluid inside the joints contain nutrients for cells to keep the cartilage healthy. The fluid also contains gases like carbon dioxide and oxygen. People think that when a joint is bent, more gas gets into the fluid, making gas bubbles. These bubbles pop, and that's the sound you hear. Scientists are still researching why our joints crack. What they do know is that cracking your joints does not cause arthritis or serious damage. You just shouldn't do it all the time. Okay, so we've got bone cells, bones, joints, and ligaments. Well, that about wraps it up for the skeletal system. It's time for me to change into my costume for... Oh yeah, muscles.